it now if you'd like.
I think I just figured it out. I don't know.
Oh, there it
Does
is.
it look?
Yep. Yep.
And the recording, it takes usually like 2 days for our IT to kind of upload it into our YouTube channel. And once that's uploaded, I will send it out to everyone. I think we have a fair amount of people already, so I'm going to go ahead and start this. This is a Q&A session, so essentially, you guys have any questions we'll address. Connie and Sheila, do you want to say anything?
This is Connie Lucido. Thank you all for joining us, and thank you in advance for any questions that we've had so far, or any that may come up in this particular call. Please keep in mind that these are as a result of COVID dollars, so we do need to make sure there's a nexus of COVID. But then it's also meant to enhance your organizations to have you better prepared for future emergent events, heaven forbid they arise. And as Tisa had introduced, Sheila Lambert was instrumental in bringing these funds to Nevada. So she has a breadth of information, that large word. So that's all I have. Thank you.
And just, I think it might make more sense if whoever has questions, just press the raise your hand button, which should be on the top right hand, and then I can call you out. I don't know. Sheila, did you want to say anything, or should we just get started?
Nope. Ready?
All right, guys, the floor is all yours.
Hi, it's Alma. I have a question.
Go ahead.
Hi, Sheila. Nice to see you again. So my question was, I believe our finance person is on here as well. But our main question is, what I saw the list of allowable expenses. So basically it looks like computer upgrade, like we can upgrade their computers and get laptops because they don't have laptops, so that they could be mobile. Does that sound right?
You are not improving existing infrastructure, you are adding infrastructure.
Right.
So if you are adding infrastructure, that is an allowable.
You said it is or it isn't?
It is.
Okay. Okay. And then
let me qualify that. It needs to be under the operating supplies, and cannot, for an individual item, go into the federal category of equipment, which is any one item over $5,000.
Okay.
That's a great question.
Is the intent, and I mean, and maybe this will be more clarified when we see the scope of work, like the subaward, but like what is the intent behind this funding? Is the intent to be able to upgrade what we currently have to access enhanced services, increase services? Is there a certain type of, like, I guess I'm just trying to get a clarification as to what the intent behind the funding is, so that I can wrap myself around what we're going to be doing with the funding to make sure that we're compliant.
So as part of the state team in the director's office, it was recognized and brought to the attention by Connie Lucido and TISA the importance of family resource centers across the state. It was also identified as a need to be able to expand and enhance the abilities of FRCs to participate in meeting the objectives of emergencies as well day to day, whether that be an existing pandemic or some of the challenges we face every single day. There are specific populations that are allowed to be targeted, which include ethnic and minority populations, rural populations, those with SUD, homeless, many of the populations that the FRCs currently serve. So it seemed like it was going to be a real easy nexus. So what we did was identify dollars for both the urban and the rural FRCs to be able to identify ways to improve your ability. It says I'm having network issues, so if I start having bandwidth issues, I'll turn my camera off. So please just let me know that. So we want to make sure that you're able to provide existing support to so many in the community who have been impacted by COVID as of today. That could be rental assistance, housing assistance, many of the programs that you operate today, and you need to expand and enhance. Now, you do have to be able to exhaust the other funding. This is federal funding, so you cannot supplant, and it has to have a separate activity to be able to demonstrate how you determine those people were eligible for those services under this funding structure. Basically, we want to enhance and enable you to be able to reach the existing people with more resources that you may not have been able to provide support to be able to expand and enhance your ability to provide ethnically and linguistically and culturally appropriate services. If that means adding some training or adding some technical assistance to be able to update your policies and procedures, we are going to have various templates that's provided to community partners throughout the state. The state has invested probably $2 million in order to have templates and have resources for you. It is for you to be able to look within your needs assessment and those gaps within your communities, and to be able to come back to Connie and Tisa and be able to say specifically how you've identified that need in your community. One community may need to have somebody who or provide better continuity, consistency of care to mental health services. There may be a linkage or need for various levels of public health. What the state is doing is we're looking at CDC as a whole. We are looking at public and behavioral health as one nexus, the whole mind, body, soul person. You need healthy food to eat. You need to be able to manage your level of anxiety. You may not be seriously mentally ill, but you need to have resources, and we want to connect you to some of the other resources and make you stronger in that network. For example, we have the Nevada Resilience Projects, which some of you are familiar with, in which we have resilience ambassadors. Connectivity to the resilience ambassadors are for those who don't have SMI, who we actually through that program connect to many of you, and sometimes you've had to turn those people away because there are just not enough funds available. So we're really looking at you to kind of take that and individualize it to your program. There are things that are going to be specifically excluded, or things that you can't justify we are not going to be able to approve. CDC is one of the most challenging federal funders. They require a high level of reporting, data, and detail. They scrutinize at a level generally not seen. So we are going to pass that along so that we can continue to bring in those dollars. So does that help kind of provide some framework? Does that help provide a little bit of where we're going with this?
Yes, thank you. That was very helpful.
Joyce has her hand up. Joyce, do you want to ask your question?
Yes, thank you, Tisa. I'm going to ask probably a couple of questions that may have been covered. We just had a mental health patient fall through our front glass window. So I've got deputy sheriffs here, and I've got all kinds of things going on. So bear with me, ladies. Okay, just a moment here. Both of these pots of funding, am I right in assuming that the amount that was on each of these emails is specific to our center?
So I'm only here to talk about the CDC pot of money. So Tisa, I would have to throw that to you.
And that's what I'm talking
Joyce,
about. Is the
CDC health disparity email that I sent out, which specified your allocation, is just for like your agency. Everyone should have received their own individual email specifying their own allocation.
Perfect. That's what I thought. Thank you. Secondly, is that the body of the email are virtually the same, you know, about what's allowable, what the focus is, and so forth. Can you, in fact, give us an idea of, obviously, one of them says training and outreach, and the other one had a different tagline, and I apologize, I'm kind of rattled here a little bit, as you can well imagine. So can you explain the difference between the grants for me, please?
So did you just come on when you started talking? I'm just trying to gauge if I need to be clear or if you heard the first part of the conversation. I'm just trying to gauge where you were at and recognizing you have so much going on behind you.
Sheila, I did hear when you talked about the intent of the funding, and you talked about rentals, you know, assistance, housing, and so forth. So no, I came on about 2 minutes late.
Okay, perfect. So you want to know what the difference is between, I'm sorry, could you say that one more time? The
two different grants that are indicated in the email. One of them, I apologize, ladies, I'm usually much more together, all right? Let's see here.
Joyce, we're just talking about the CDC Health Disparity Award.
Okay. You're not talking about the CDC Nevada Outreach Training Organization. That one, I got 2 separate grants that came to me with 2 different total allocations. Is there only one that we're talking about, or are we talking about both of them?
So tell me who sent you each of the awards.
Tisa, you sent them both to me. One of them is titled DO 1232, Nevada Outreach and Training Organization, CDC Health Disparity Allocation. The other one is deemed DO 1224, Ron Wood, CDC Health Disparity Allocation and other pertinent information. So, and they have 2 different amounts on them.
So I think what I may have done is accidentally sent you an email that was meant for Noto. But so it is 1 grant and it is the CDC Health Disparity, and you should be on the subject line Ron Wood.
Oh, I see what you did. You sent them both to me. I'm going, okay, 2 separate pots of money. So we'll throw this one out.
Sorry.
Okay. Yeah, because they have the same body of the email, and I'm going, holy cow. So what's the difference in these 2? Yeah, so
that makes
all
sense.
Right. Okay, and those were my 2 burning questions. So thank you. Appreciate it, ladies.
I just want to add, we recognize that the rural and frontier partners were also based on formulas often do not get an adequate amount of dollars to be able to operationalize some of the programming. So in the CDC grant, there was the utilization of the formula with an enhancement specifically set aside as a requirement of the CDC Health Disparity Grant. So rural partners got a higher allocation than they typically would have under the basic formula funding. And that was a requirement of the CDC Health Disparity Grant for us to actually kind of reach out to our rural and frontier partners. You guys are making this way too easy on me.
Tissa?
Oh, I was muted. Go ahead. Ann?
This is Ann from East Valley. I have a couple questions. I understand that we can use it for rent and utilities, which is a big function that we see right now. But my other question is, we had our van stolen back at Christmas time. And if we wanted to develop homebound deliveries to people with COVID or just disabled that can't get to their food, is that something that would be covered under here?
We do not have authorization for equipment purchases. So if you're asking if you can buy a new van, I would say at this time the answer would be no.
Okay. Thank you.
I hope your insurance refunds you.
They did, but not much. It's not enough to buy a new one.
And did you have any more question, or was that it?
That's it for now, I think.
Thank you. Who else?
I kind of want to go back to Anne for just a second if I can. So I never like to tell anybody no. So as Connie will know, I always want to sneak or wrap around that question a little bit and tell you what would be allowable. If you were going to use a rental vehicle for a period of time that was under a certain amount of funding to allow you to provide support for a short period of time, that would be something we would consider because it would be under a different category. But it's going to be very difficult for you to document for you to get that approval. But if you're if you need it and you're willing to justify it and do the extra work that's required for something like that for a short period of time, because that would be highly scrutinized. I don't want to turn you totally away because we do know homebound deliveries are very important. We're just very limited with the funding. So if you can come up with a creative project approach, implementation time frame, and be under certain dollar amounts, we would like to look at it. And then if we have any questions, we can always provide it to the CDC GPO, which is the General Program Officer, and ask for clarification of use.
Okay, thank you, Sheila.
Aaron, you have your hand raised.
Yeah. Is there any geographic limitation on this as far as who we can assist, as we're family resource centers? We all have geographic limitations on that particular grant. Does this limit us to the zip codes that we have in the FRC, or can we use it for Greater Clark County?
If you want to utilize these dollars for the county that you are in, this grant would not limit you but to zip codes. That's a good thing. I mustn't know how your funding works, so. The goal is to reach as many people as possible who are in need, and we look at the FRCs as one way to do that. So I certainly don't want a line on a map to make that determination during COVID.
So let's do Joyce and then Alma.
Thank you so much. Sheila, I appreciate your talking to the supplanting issue. I currently have American Rescue funding, and I currently have HUD funding. I am taking care of rental properties right now. There is a limitation on how much I can use. Is there a appetite for dovetailing some of the most in need, if in fact, not supplanting, but looking at a different time period, if in fact these individuals are still in need within the grant period?
So I think I'm struggling with your question, but let me see if I can give it a try. So you currently have rental assistant fundings through HUD. You
Correct.
currently have rental assistance through ARPA. And those grants would have to be expended for that rental assistance before you could use this grant for rental assistance.
Okay. Thank you so much.
Typically we don't get funding that overlaps each other. So one of the questions on one of our technical phone calls, since every grant wants to be the payer of last resort, has made it a little bit more challenging. So the technical assistance that we received during a phone call was that if you have the date of the first grant, so if you had an ARPA grant that started January 1st, a COVID grant that started February 1st, and CDC that started March 1st, you would have to expend those rental funds for the January 1st grant before you go to the February 1st grant and before you go to the March 1st grant. And I think that that was just one mechanism that they were using, as of course everybody wanting to be the payer of last resort.
On a related question, Sheila, thank you for that clarification. On a related question, we do work with, and I have noticed on the grant that there are areas regarding homeless and of course the more vulnerable populations. Unfortunately, some of our funding that I spoke of does not cover those particular shelters and outlets. If they're in motels and things of that nature, they will not cover that. However, these people are on weeklies and so forth. Would in fact this funding, first of all, can it be paid for a month upcoming or a week upcoming, or does it need to be in the rears as long as it doesn't predate the grant period of time?
This is a reimbursement grant, and so the money, it's really difficult for smaller organizations to outlay certain amount of funds in the beginning, and I certainly understand that. But the challenge is if you pay front and then that individual doesn't stay or they go someplace else, then you're going to have to refund refund those dollars because they didn't show up on that particular day or stay that length of time, and you can't validate that residence. So that's really more of an internal question to you as to whether or not you're willing to potentially have to pay back those dollars.
Great, thank you for that clarification. So again, my question regarding unconventional housing, where it is motels that maybe don't have a lease agreement, but we can get a statement from the landlord or the property manager of record. Is that allowable without a lease agreement or a rental agreement because of the need for housing for these individuals?
I would think we'd have to review what approach you're going to take with that and how you're going to validate who is using it, how that person was identified. So if that's something that you would like to propose, I want to make it clear that if you propose something that isn't going to work, we're not going to reduce the dollar amount allocated to you. We're going to continually work with you until there is a plan in place. So if you have a program like what you're identifying and you believe that this is what you can do, and you clearly delineate how you're going to measure it, how it's going to be directed, how it's going to be managed, and there's a level of comfort, then of course we're going to do everything we can to approve it. If it's just not to a place where we believe it's going to be in compliance with the CDC regulations, then we're going to continue to work with you to make sure that you can spend and use that money. So if that's where you believe your highest and best needs are, again, this is one of those tough areas, as you know, with many of the grants. So I would encourage you, if you're willing to spend the time and draft up the details and what the reporting would look like and how you would ensure compliance, I would encourage you to put something of that together and then let us review it. And maybe there'll be something that we can work on. When I drafted the CDC grant, the goal was to provide the greatest amount of flexibility. So the reason why, and I think that it does two things. We're not used to such ambiguous language where it's like, oh my goodness, we really need to reach this population. We really need to do that, because you're most of the time being told what your limitations are. I would like for the team to kind of take off those limitation glasses and look at what those true needs are in the community for those impacted by COVID. And if we can make it work, we'll make it work with you. And if it doesn't, we'll keep revisiting that issues until you get those dollars. It's not going to be like similar grants where you propose a program and a certain amount of dollars, and then if it doesn't work, you don't get any. We're not planning on taking those dollars away unless you can't come up with any program, and then I'm sure your neighboring partner would love to spend those dollars. Because unlike FRC dollars, they will be reallocated if you're not able to spend them. I see some people smiling with that, and I see other people kind of scared of that. So, you know, as you work through this, I know Tisa is available for me, and as she is for you all the time. If there are other questions or other, you start getting into something, I know many times we start off a program or a grant and we start going down one path, and it starts to generate ideas within the team, and you then totally go a totally different direction. Please feel free to be open and communicative and ask and until you think that you've got what you need for your community. There's no limit on questions. And I want you to explore the chance that you have now with some of the freedoms that you don't have with your with your main pot of dollars. But just the health disparate population, you know, those that are targeted, are homeless, are SUD, are rural, are ethnic, are religious, are LGBTQ, are all of our communities are impacted, these ones. And so part of what you'll need to identify is which populations you are targeting with various programs, and they don't have to be limited to one.
Let's do Alma and then Lisa.
I'm sorry, I didn't think I had my hand raised.
Oh, okay, that must be from earlier. Sorry, Alma. Lisa, did you have a question?
Hi, yes, thanks. I was just wondering if you could touch on the reporting requirements, and do you think that we'll be able to do all of the tracking in eLogic, or what are you kind of envisioning there as far as the tracking that'll be needed for the funding?
Ideally, you're going to need to track things within eLogic because that's your data system. But I'm not familiar enough with it, so I would have to defer to Tisa to work with you to come up with a way to track that. It's coming to the point where I'm not going to be able to avoid it much longer, but I've been avoiding eLogic for quite a while, and it's kind of starting to come up a lot more now. So but Tisa will work with you on those reporting and that data collection and make sure that it matches what the grant is. And the idea is we don't want to overburden you, but we do need to have, you know, those specific reporting. So if there's a way or a mechanism that we can reduce that reporting burden and have you focus on the clients instead of reporting, we want to do that.
Thank you.
So I will work with eLogic and ask them to create a specific tag that says CDC health disparity. So you can use that tag in terms of all the services that you provide from this specific funding.
Okay.
And I will get back. Sorry, go ahead, Lisa.
I said I told you were much smarter than I was on the eLogic stuff.
And then I will get back to you guys in terms of the reporting as soon as I learn a bit more about the CDC reporting requirements from Sheila.
And they'll be different for each program. So that will be, so because well, you guys maybe all of you guys decide you're going to spend all the money on food distribution, then those measures would be the same. But the measures and the reporting is going to be specific to your program. So that's why we can't just give you one reporting tab because we're going to be working with you to individualize it based on what you determine is a priority.
So I'm sorry, I didn't raise my hand.
That's fine, go ahead.
So will given that what we use are the funding for will likely be different for each site, is there going to be like a budget template or scope of work that you send out that we then work on and have to submit?
So Alma, the email that I sent out about this with your allocation has the budget template and scope already, and it's the one that we use for a unit, so it's not different.
So now the next steps is you need that budget template back, and I'm guessing there's like a
By
due date.
September 15th. I need it back by September 15th, but like Sheila said, we will work on you in refining your program ideas.
Okay. Thank you.
And part of the reason we need that date is that we have to demonstrate that we are taking steps forward and that we are moving to expend those dollars. The very last thing the GPO wants is Nevada returning those dollars. So Nevada received $32 million and Clark County Southern Nevada Health District received $22 million out of the CDC Health Disparity Grant. They were the only two organizations in Nevada eligible to apply and both received. So for those of you that are in Clark County, I would also encourage you to reach out to Southern Nevada Health District to determine if they've completed all of their allocations. Like most partners with those larger sum of money, sometimes it's very difficult to expend those dollars, and that sometimes they are looking for someone who might be able to expend them quickly to help them if another partner has backed out.
Joyce, you had a question?
Yeah, is there an issue with, I'm trying to think of things that obviously are gaps that we're running into. And one of those are utilities, you know, to keep people warm or, you know, taken care of in their home. And the other one is, since gasoline is so expensive, to get to their medical appointments, to get to their, you know, whatever they need to do. We were talking, we've already had a discussion with my staff, and one of the areas that they were interested in is gas cards. How do you feel about those items, utilities and gas cards?
So utilities, it seems like especially if you've got programs and processes in place now. When we talk about gas cards, they have to be specific to providing a service. So if you provide a bus pass to somebody and they're able to get to a medical appointment, you know that that bus pass is specifically being used to service that medical appointment or that behavioral health appointment, or to get to the food pantry or to get with it wherever. When you give somebody a gas card in general, you don't know what they're doing. You're basically giving them a free $50 that's unaccounted for. And so that one would be much more difficult to justify, and I don't think that that's something we would be able to do. But if you were looking at bus passes, or you were looking at other modes, we would love to hear about it. It has to be able to be tied directly back to that individual with service, and filling up their tank of gas is not going to do that.
Thank you.
This is so good, guys. I mean, feel free to ask questions because this is good for all of us collectively as we learn more about this grant. Anne, go ahead.
That brought up another question of what about food cards? So we keep perishable food, but a lot of times these people don't have food to make a full dinner. Would we be able to purchase gift cards for meats, as long as it's specified no alcohol, no cigarettes on it?
It has to be, you nailed it. No alcohol, no cigarettes. It has to be those items that would be allowed under a SNAP or WIC program. It's probably similar guidelines you have now, I would expect. But absolutely.
Okay.
We also have, as part of the CDC Health Disparity, there's also dollars that are going out to enhance food pantries as well throughout the community. So hopefully they will be able to provide a stronger resource to you guys as well.
Thank you.
Penny had a question. Food purchase for a food bank.
For a food bank? No, that's not serving an individual. Wait, is that the question? You're buying food to give to a food bank?
Wait, just responding.
I think it's food to stock our food pantry, unless I'm misunderstanding.
Yes, she's nodding her head. Food to stock the agency's pantry. Fill our food bank.
So let's walk that all the way down to use. You would still be collecting data and populating eLogic, tagging CDC health disparity. So if those activities were occurring, I'm going to flip that back to Sheila. Would that be permissible?
I so want to say yes.
I know.
And my struggle is that you have to link the person to the program, and you may stock your pantry and give it to somebody who is not part of the program. And so that's where I'm coming up with this gap. So if there was a way that you could write a program approach and you had a way to set it aside or do whatever your program methodology is, so that it can make that linkage and be reported in eLogic, then we would want to say yes, but we'd have to see what it looked like in terms of making sure we could link those purchases to those clients. And I tell you, I want to say yes to this. So, but really you're going to have to tell us how you would manage that to make sure that we have the individual reporting. So I know you guys are so creative with limited resources, so you guys may have a separate storeroom. You may have, purchase certain products only for COVID. Something that makes it where you can justify that.
Can I give you an example on that, Sheila? Is what I'm thinking in my head. So I have 13 clubs in our organization. So if we took like an empty office and we converted that into a pantry, so our caseworkers don't have to travel with food, and we stock that pantry up so that those clients that are getting food from that pantry would be tracked to the CDC Disparity Health Grant, would that be allowable?
You would have a separate COVID pantry that for each thing that you would distribute out of that pantry only goes to eligible clients. Yes.
Okay, because I have different locations. So okay, got it. Thank you.
And as long as that can be tracked within eLogic, and then that's what you're doing. So if CDC decides to fly to Nevada and I do a site visit with them and we show up at your place and you're going to be able to walk us through how you determine that, I think that would work.
Okay, wonderful. Thank you.
So Penny, you wrote this grant will be hard for your agency to expand. Do you think what Alma just suggested, could you do something like that? No? Why don't we talk offline then, maybe?
So Penny is from which organization? I'm sorry.
We're out rural, the Kapalapa Family Resource Center.
So I guess I just kind of want a little feedback because other people might be having the same thing. What is your challenge with expending these funds?
Okay, so during COVID, we did have some funding that was for rent and utilities, and basically we couldn't find anybody to give it to be within the guidelines. So with so many restrictions, it just makes it very difficult. And we're small anyways, and then to find those extra people to bring in is COVID, it's been very difficult. So as far as setting food to a different section, that would be impossible. That was sort of like when we did the commodities, that was kind of hard as well, to make sure you're not giving food to somebody that shouldn't have, you know what I mean? It's mixing foods together, that type of thing. So it's really difficult.
Okay, so what if you thought of it differently in terms of maybe you focus on a specific population, and I'm just gonna baby diapers. So you purchased baby diapers for at-risk and at-need families, and that's the only thing that you keep on site for those COVID families. You could nail it down to something where it's the only thing that you are using for those COVID populations so that you don't have to keep things separate and distinct. I'm just throwing out ideas here because we really want you to be able to utilize the money in your community. So I was just trying to understand, the challenges, but particularly with those in the rural and frontier communities. And like Tisa said, we will help you find a way to spend the money that will support your program and not just spend the money for the sake of spending the money. Because we definitely want it to make sense for you and make sense for the community. But I bet if we put our minds together, we'll come up with something that can work. So don't give up on us yet, Penny.
And Carla, that's the same for you. Carla wrote from CAUSE. I feel like our agency will also have a hard time expending the funding. So what I'll do is I'll follow up and set up offline calls with each of you. Don't worry, Carla, it's fine. I got you.
And you know what, and I think that's if you're not able, if we're able to only expend 50% of what you're allocated, that's a fair thing. We appreciate that honest feedback because that will then also allow us to redistribute that to other communities. And if it's rural funding, we would redistribute to other rural communities, that sort of thing. Sorry, Washoe and Clark, but we have a rural frontier mandatory set aside. So if a sister agency has a mechanism and it's not, predicated on zip code and there's some teaming or partnerships that we can build with that, we're willing to do that as well. But we do want you to be honest because every time we turn back a federal dollar, it's like an F on our report card. They will continually reduce any future dollars that we can spend, and so we want to make sure that we expend every dollar to every citizen we can. So if at the end of the day we only get to a certain dollar amount, that's an okay thing too. We will reinvest in the state another way.
And did you still have your question? You had your hand raised for a while.
I was just going to talk about how the food bank would be, but Leah just said, what about hospital bills? People that are going into the hospital for COVID and they're no.
There's other funding sources for that. Sorry.
That's okay.
So if people are having mental health crisis, there are COVID dollars at Reno Behavioral at Desert Parkway. It's mandatory for them. We have the Medicaid. We have the we have the subsidies that are going on for co-pays for underinsured. So there's a lot of that money out there. If your clients or you need additional information on how to tap into some of those resources or to help your clients determine what might be appropriate for them, because I believe you guys also do Medicaid determination, so that would be kind of the easy one. But those who kind of are in that gap population where it sucks to work, but you can't live, I don't know how to say that nicely because you're not eligible for this, but you can't afford any food, and you kind of get in this stuck zone when we talk about SNAP or Medicaid. And we have identified some programs and services to help with some of that during COVID.
Jen, did you have a question?
Yes. First of all, my apologies for being late. It's pretty nasty here in Douglas County with the evacuations right now, so I got stuck. My apologies. So if I'm asking anything that's already been covered, I apologize. With our FRC being so focused on parenting and that type of thing, I am also struggling with something that we could utilize these funds for. Douglas County is a rather prosperous community, so as far as like our food closet is helping individuals on a huge level at this point. They're helping so many people that they're helping Alpine and probably El Dorado now with their recent evacuations. So food isn't really a need in our community, and so I'm just kind of a little stumped right now on what we could do. Public transportation is not a thing in this community very much as far as bus tickets and that type of thing. So if I had missed any suggestions, I apologize. If anyone has any, I'd love to hear them.
Housing and rental payments. Are you guys?
Housing, is that an option?
Yes, I would encourage you, since you've missed a big portion of it, so when Tisa sends out the recording,
Oh,
at
perfect.
least listen
Okay.
to the first 3 minutes,
Okay.
and hopefully I rock your world.
Oh, fantastic. Thank you.
And Jen, if you have any follow-up questions, I'm always here. Just email me.
Okay, perfect. My apologies again for being late.
No, not at all. This is a very flexible grant, so pretty much you determine what the need is in your community, not restricted by zip codes. You know, if you need to provide some supportive services for people to get back to work, including a couple of weeks of daycare, that could be considered.
Oh, wow.
I mean, this is it has to be reasonable, it has to be justified, and if you identify the gaps and needs in your community to get people back to work, to get people back to school, to get people back healthy, for their mind, body, for you to build up cultural capacities for your staff, including engagement, for you to bring on linguistic lines for those who are Spanish speaking in the community, I could probably go on for an hour or so of ideas. So we will throw them out there, and you'll have to poo-poo all of them before we find something that might work, but we'll get you there.
Okay, perfect. So we do have the flexibility within this grant that if one of our programs, that Family Support Council is one of those ones that has 50 million things under its umbrella, and we work with a lot of victims of domestic violence, sexual assault, and adults with developmental disabilities. So we would be able to possibly utilize those communities to help support through the FRC now. Not the FRC, but kind of, sort of.
For the CDC funding, you went really fast through those populations. If they are an ethnic or religious minority population, if they are homeless, if they have substance abuse disorder, if they are underserved, if they are in a rural community, if they are any of those ones identified, then we can help you provide support and services.
So being in a rural community and working with adults with developmental disabilities, that's kind of covers a lot.
It covers a lot, and then we'll have to drill down when you put your proposal together. And one of the things we mentioned before is we're not going to take away those funds if we need to tweak your proposal. We will keep working with you until there's a proposal that meets the CDC requirements.
Awesome. Thank you, ladies. My apologies again.
It's okay, Jen. Thank you. How goes it, guys? Do you have some more questions? As usual, I am always here if you think about other questions after this call, tomorrow, this weekend, just shoot me an email and I will make sure they're all addressed.
Thank you so much. We really appreciate it.
Well, I want to thank Sheila first and foremost for being so instrumental, as Connie said, in bringing the CDC Health Disparity Grant and then allowing us to include FRCs to it. So thank you so much. Thank you for being available for this call, Sheila. And she's going to be a part of this grant for the long haul. I will make sure so that we can really utilize her expertise. Thank you so much to you guys for jumping on and asking these questions. Please continue to ask questions and we will help you refine your program. And Connie, did you have any last words?
I don't. I think between you and Sheila, you both have it covered. I'm so very excited for the things that this can do in everybody's communities.
You guys have the heavy lifting. We got the easy part. So we recognize that you are boots on the ground and that this is a great opportunity for you to showcase so that we can work together to try to continue to expand and enhance FRCs in the map.
Thank you, guys. This will be posted. Give me 2 days for the IT folks in the background to post it and I will send it out. Thank you. Have a good evening. Bye, guys.
Thank you.
Thank you.